Hello, my name is Emily Marble. I'm a student at Frontier Nursing University. My paper was about the relationship between depression and the risk of substance use in adolescents. The purpose of this paper is to explore the multifaceted relationship between these two problems. When substance use and depression occur concurrently in young people, it can be a daunting situation for families and individuals and healthcare treatment teams that attempt to apply care. Understanding this relationship is very important in trying to come up with long-term solutions that will help young people with these health issues. My paper, there have been a couple of conflicting studies in the past about the relationship between substance use and depression in young people. Some studies have suggested that substance use caused depression, and other studies have shown that depression may cause new initiation of substance use. This paper by Wilkinson, Halpern, and Herring showed that there is a bidirectional relationship, which means that both of these seem to be true. Some contributing elements to new initiation in young people with depression are negative urgency and internalizing symptoms. In a little bit more detail. So as I said, there's a two-way connection between depression and substance use. In this study by Wilkinson et al., there seemed to be an increase over time in smoking tobacco in female subjects with depression, and an increase in use of cannabis in male subjects with depressive symptoms. So it seemed that in men versus women, or just young men, there was a difference in preference as far as their use, but that this was an attempt at self-medication for these symptoms. Unfortunately, this does not seem to be an effective way of treating depression. Young smoked tobacco in this study experienced increases in symptoms over time. Young people with depression were 40% more likely to begin using cannabis for the first time than adolescents without depression. But unfortunately, this did not seem to be an effective way of taking care of this issue. Substance use can also create difficulties in family circles and in social dynamics in young people, and increase their likelihood of coming in negative contact with law enforcement. All of these things can contribute to worsening of depression and other mental health problems. Hence, to new onset of substance use in young people with depression are negative urgency and internalizing symptoms. Negative urgency is the tendency to make rash decisions as a result of a distressed or depressed emotional state. The feelings involved in depression can accumulate to influence adolescents to act without thinking ahead about the potential consequences of their actions. This emotional vulnerability can make it much more likely that an adolescent will experiment with various substances, especially at an early age. The same study by Pang et al. Stated that the age that an adolescent begins to use alcohol or marijuana has a significant adverse impact on long-term outcomes. And as a result, these findings indicate that it's very important to treat adolescents for depressive symptoms before they begin experimenting with substances. Internalizing symptoms of depression are symptoms that are pointed inward rather than outward, and these symptoms can make young people be at much higher risk of starting to use substances. Unfortunately, adolescents who used cannabis in this study had higher rates of panic and depression symptoms. They felt less connected to their emotional communities, educational communities, and are much more likely to have used other substances, including alcohol. Findings in Wilkinson et al. Study that proposes that adolescents who use substances are at an increase, are subject to an increase of depressive symptoms. In conclusion, after reading all these different studies, I determined that prevention seems to be the best way of treating these concurrent symptoms. Screening and early treatment for depression is critical in keeping young people with depression from starting to use new substances. And here's my reference page. Thank you for your time.